The emergency room was packed that night. Cameras were rolling, and what happened next would spark a national conversation that nobody saw coming. A single moment, a heated exchange, and millions of viewers who couldn't look away. This is the story of how one tense encounter in a hospital ER became one of the most talked about moments in reality television history, and why what happened afterward left everyone questioning what they thought they knew. If you're interested in stories that reveal the complicated reality behind the scenes of our healthcare system, hit that like button and subscribe. This is one you won't want to miss. Let's dive in. To understand why this moment hit so hard, we need to rewind a bit. The show in question was a documentary-style series following real medical professionals through their shifts. Unlike the polished medical dramas we're used to seeing on primetime television, this was raw, unscripted, real patients, real doctors, real pressure. The series had been praised by many viewers for showing the reality of working in emergency medicine. Long hours, difficult decisions, moments of triumph and moments of heartbreak. Critics had called it an unflinching look at the front lines of healthcare. But it was also controversial from the start. Medical ethicists raised questions about patient privacy, even with consent forms signed. Some healthcare workers felt the show sensationalized their profession. Others believed it was an important window into a world most people never see. The episode that would change everything aired on a Tuesday night in the fall. Viewership had been steady, but nothing remarkable. The network wasn't expecting what came next. The central figure in our story, let's call her Dr. Martinez, though that's not her real name, had appeared in several episodes before this. She was a veteran ER physician with over 15 years of experience. Viewers had seen her handle everything from traumatic injuries to difficult family conversations, with what many described as professionalism and compassion. On this particular night, the ER was understaffed. A flu outbreak had already strained resources, and the waiting room was filled beyond capacity. This is where our story really begins. The cameras captured everything. A patient, we'll call him Mr. Johnson, had been waiting for nearly 4 hours. He had come in complaining of severe abdominal pain. Triage had assessed him as non-urgent based on his vital signs, which meant he would have to wait while more critical cases were handled first. Anyone who spent time in an emergency room knows this is standard procedure. But knowing the policy doesn't make the wait any easier when you're in pain. The footage shows Mr. Johnson approaching the nurse's station repeatedly, asking for updates. His frustration was evident. The nursing staff, clearly overwhelmed, tried to explain the situation. Priority cases had to come first. A car accident victim, a child having an asthma attack, a suspected heart attack. But Mr. Johnson was done waiting. When Dr. Martinez came out to triage the next patient, Mr. Johnson confronted her directly. The exchange was tense from the start. "I've been here for 4 hours," he said, his voice rising. 4 hours and nobody will even look at me." Dr. Martinez, visibly exhausted, tried to explain. "Sir, I understand your frustration. We're doing everything we can. Your vitals don't indicate an emergency at this moment, but I promise we will get to you as soon as possible." What happened next is where opinions diverged dramatically. Mr. Johnson raised his voice further. He questioned her competence. He made demands. And then, and this is the moment that went viral, he said something that many viewers interpreted as crossing a line. The exact words were caught on camera, but the context is what matters here. Some viewers felt Mr. Johnson's frustration was completely justified. After all, he was in pain. He'd been waiting for hours, and the system seemed to be failing him. Others felt his behavior became aggressive and inappropriate, particularly toward the medical staff who were doing their best in an impossible situation. Dr. Martinez's response is what stunned everyone. She didn't back down. She didn't call security immediately. Instead, she addressed him directly, her voice firm but controlled. "I hear that you're in pain. I hear that you're frustrated. But I need you to understand something. There are people in this right now who will die if I don't treat them first. That's not me being callous. That's me doing my job," she continued, and this is the part that sparked the most controversy. "You have the right to be upset with the system. You have the right to be frustrated with the wait times. But what you don't have the right to do is question my judgment when you don't know what's happening behind those doors." The camera held on both of their faces. The tension was palpable. Mr. Johnson didn't back down either. He fired back, questioning the priorities, questioning the system, questioning everything. And then Dr. Martinez made a decision that would define what came next. She stepped away from the triage area, went back to check his chart more thoroughly, and returned 5 minutes later. She had reprioritized his case based on some additional information she'd noted. He was taken back for examination within 20 minutes. The diagnosis: a condition that, while not immediately life-threatening, did require prompt treatment. Surgery was scheduled for the following day. When the episode aired, social media exploded. Within hours, clips of the exchange were everywhere: Twitter, Facebook, Reddit threads with thousands of comments. The moment had struck a nerve. One camp argued that Dr. Martinez had handled the situation perfectly. Many healthcare workers themselves commented, sharing their own stories of verbal abuse, impossible working conditions, and the emotional toll of constantly having to justify medical decisions to frustrated patients. "This is what we deal with every single day," one nurse wrote in a widely shared post. "People don't understand that we're triaging based on who will die first, not who's been waiting longest." Medical organizations praised Dr. Martinez for standing her ground while still ultimately providing care. Several prominent physicians appeared on news programs to discuss the realities of emergency medicine triage. But the other camp saw things very differently. Patient advocacy groups pointed out systemic failures. 4-hour wait times shouldn't be normal, they argued. The fact that patients are put in positions where they feel desperate and ignored is itself a failure of the healthcare system. "Nobody wins in this situation," one healthcare policy expert commented in an interview. "The patient suffered unnecessarily. The doctor is clearly burned out. The system is broken, and we're watching two people caught in the middle of it clash because they have nowhere else to direct their frustration." Many viewers felt that while Dr. Martinez's point about life-threatening emergencies was valid, her tone had been dismissive. They argued that showing compassion doesn't mean compromising medical judgment. It means acknowledging people's suffering even when you can't immediately address it. Mr. Johnson himself gave an interview a week after the episode aired. His perspective added another layer to the story. He acknowledged that he had been aggressive. He apologized for his tone. But he also described the physical pain he'd been in, the fear that something serious was being missed, and the feeling of helplessness that came with being ignored for hours. "I wasn't trying to make her job harder," he said. "I was scared, and I felt invisible." Dr. Martinez also eventually spoke to the press, though more reluctantly. She expressed regret that the situation had escalated, but stood by her medical decisions and her response. "I would handle the communication differently if I could do it over," she admitted. "But the medical prioritization, that I can't apologize for, that's my job." The conversation expanded beyond just this one incident. Op-eds were written about burnout among healthcare workers. Investigations were launched into ER wait times at hospitals across the country. Policy makers began discussing reforms: patient rights, doctor well-being, systemic failures, funding shortages, insurance complications. The moment had opened up a much larger conversation. So what actually changed after all of this? The hospital where the incident occurred implemented new protocols. They added staff to specifically handle patient communication during long wait times. They created a system for periodic updates to everyone in the waiting room, explaining delays and setting realistic expectations. Other hospitals reportedly began examining their own procedures. The viral moment had created what some called a watershed moment in discussing emergency room management. The show itself faced decisions about its future. Some called for it to be canceled, arguing that filming in emergency rooms was exploitative and that the presence of cameras might influence behavior. Others argued that the transparency was valuable, that seeing these real moments helped the public understand the pressures on the healthcare system. The network ultimately continued the series, but with additional protocols about patient privacy and clearer communication about the nature of the show. Dr. Martinez continued working in emergency medicine, though she stepped away from being filmed. In a later interview, she reflected on what she'd learned from the experience. "I went into medicine to help people," she said. "What I didn't fully understand early in my career was that helping people isn't just about medical skill. It's about communication. It's about seeing the human being in front of you, not just the medical case. I think I lost sight of that in my exhaustion that night." Mr. Johnson recovered fully from his medical issue. He became an unexpected advocate for healthcare reform, speaking about his experience at policy forums and working with patient advocacy groups. "I don't want anyone to go through what I went through," he said in one speech. "Not the weight, not the fear, and I don't want doctors to be put in positions where they're so overwhelmed they can't show compassion even when they want to." The relationship between the two remained complicated. They never became friends, but they did eventually have a private conversation facilitated by the hospital. Details of that conversation were never made public, but both described it afterward as meaningful and necessary. So what's the lesson here? Many viewers came away with different takeaways, and perhaps that's appropriate for such a complex situation. Some saw it as a story about the importance of empathy, even in impossible circumstances. Healthcare workers are human beings under enormous pressure, but patients are also human beings in vulnerable moments. Both truths can exist simultaneously. Others saw it as a call for systemic change. Individual compassion is important, but it can't fix a broken system. When hospitals are chronically understaffed, when wait times are measured in hours, when both patients and providers are pushed to their limits, that's a policy failure, not an individual one. Still, others focused on communication. How we talk to each other in moments of stress and frustration can either escalate or de-escalate situations. Words matter. Tone matters. Being right doesn't always mean winning the interaction. Perhaps the most important lesson is this: these moments of tension reveal deeper truths about our society. They show us where our systems are failing. They expose the human cost of policy decisions made far from the front lines. They remind us that behind every healthcare statistic is a person, both the patient in pain and the doctor trying to help. The viral moment didn't solve healthcare. It didn't end burnout among medical professionals. It didn't eliminate long ER wait times. But it did something arguably just as important. It made people pay attention. Sometimes that's where change begins, with a moment that makes us uncomfortable, that forces us to see a problem we'd rather ignore, that demands we reckon with the gap between the healthcare system we imagine and the one that actually exists. The tense ER moment left viewers stunned, yes. But what happened next, the conversations, the policy discussions, the personal reflections, that's what really changed everything. It's a reminder that television, even reality television, can serve as more than just entertainment. It can be a mirror showing us who we are and a window showing us who we might become. If this story made you think differently about healthcare, about communication, or about the complexity of situations that look simple from the outside, hit that like button and subscribe for more commentary on the moments that shape our cultural conversations. What do you think? Was Dr. Martinez right to stand her ground? Should Mr. Johnson have been more patient? Or is the real problem bigger than any one person's response? Drop your thoughts in the comments below. Thanks for watching. And remember, empathy costs nothing, but it's worth everything.